My name is Mayowa Adeshina, and I'm a student nurse practitioner from Brandman University. How are you doing today?
I'm very well, thank you.
So I'm going to be interviewing you and examining you today. All right, is that all right? May I ask what your full name is?
Tolulope Aji.
And how would you like to be referred?
Tolu.
Tolu. All right. Tolu, what is your date of birth?
January 31st, 1990.
Okay. And how old are you?
I'm 31 years old.
31 years old. All right. So, what is today's date?
February 28, 2021.
2021. All right, good. And who is the president of the United States?
Joseph Biden.
Joseph Biden. Good. Do you know what building you're in right now?
I'm at a clinic.
At the clinic. All right, good. And what brings you here today?
I came to establish a primary care with a provider because we just moved into the area.
Oh, okay, good. So you're here for your physical?
Yes.
All right, good. So to do the physical, I have to ask you questions and I have to do the physical examination.
Okay.
Before I do that, I just want to say that before I came in, I washed my hands and I've also closed the door and pulled the curtain to provide for privacy. And also, I made sure there's good lighting in the room. As you can see, the lighting is pretty decent for the examination we're going to be doing today. And so, after doing all of that, I also checked your vital signs. Outside, I made sure that I checked your height and your weight. So I use that to calculate your BMI, and your BMI is normal.
Okay.
Your vital signs are also normal. So then, what I'm going to do now is, I'm just going to say a couple of things. Today, I'm not going to be testing your breast, or I'm not going to be doing a breast exam, or doing a genital exam. I'm going to defer those two exams. And also, while I'm doing the examination or asking you these questions, if at any point in time you feel any discomfort, please don't hesitate to let me know.
Okay.
All right. And if you have questions also throughout the examination, please stop me and ask me questions.
Okay.
All right. And then, as I'm looking at you, you look pretty. You look pretty good. I like your posture and your stature already. You look, very well nourished. So I'm going to actually start asking the questions.
Okay.
Is that all right?
That's fine.
All right. So before I actually continue, I think I just ascertained that the patient here is awake, alert, and oriented to person, to place, to time, and to purpose, times 4. And because of that, she seems like a good historian, which means that she knows why she's here. She told me about the chief complaint, which was to do a physical. And I also was able to find out that she's going to be the person that's going to be talking today. So she's my source of information, source of history, and she seems like a reliable source. So the first question I'm going to ask you is, do you have any allergies?
No allergies.
Any allergies to food?
No.
Any drug allergies?
No.
Or allergies to medications?
No.
Okay. And do you have any seasonal or environmental allergies?
No.
No. Okay, no allergies. Do you have any past medical history?
No medical issue.
This is including things like having diabetes, hypertension or high blood pressure, high cholesterol or hyperlipidemia.
No.
Okay. How about maybe thyroid problems?
No.
Heart problems?
No.
Okay. Respiratory problems?
No.
Okay, like COPD, things like that.
No. Okay.
What about kidney problems?
No.
Okay, migraines,
No.
liver problems.
No.
Okay, what about alcohol abuse or drug abuse problems?
No.
Okay, good. So no past medical history or current illness.
No.
Okay. How about childhood illness? Any childhood illness?
Not that I can remember now.
Okay, all right. Any previous hospitalizations?
I've never been hospitalized.
Okay. How about any previous surgeries?
I've never had surgery.
Okay, all right, good. And there are some specialists that I feel like maybe you've been visiting quite frequently. Let me ask you about them. When was the last time you saw your eye doctor?
I saw my doctors about 4 weeks ago.
4 weeks ago. How about your dentist?
I saw my dentist 3 weeks ago.
Okay, when you saw your eye doctor, were you prescribed any glasses? Do you wear any prescription lenses or any corrective lenses?
No, I do not wear any.
Okay, So eyesight is pretty good.
Yes.
Okay. And you say you saw your dentist as well.
Yes.
Okay. What about your OBGYN? When was the last time you saw your OBGYN?
I saw it about 4 weeks ago as well.
4 weeks ago? Okay, so you packed everything into one and did that.
Mm-hmm.
All right. When you saw your OBGYN, did you get your pap smear done?
Yes, I did.
Oh, perfect. Was it normal?
Yes, it was normal.
Oh, good. Okay, now I'm gonna ask, are you sexually active?
No.
Okay.
I'm single.
You're single. All right. Okay, so you're not married. You're single.
No.
All right. When was the last time you had your menstrual period?
That will be January 30th, 2021.
Okay, so this year.
Yes.
January or last month,
Mm-hmm.
January 30th. And are your periods and menstruation cycles normal?
Yes, it's pretty normal.
Okay. Do you find yourself spotting when you're not on your cycle?
No.
Okay. At what age did you start menstruation?
13.
13. Okay. And you have you been pregnant before?
No.
Okay. Do you have any children?
No.
Okay. Now I'm going to ask you questions about safety. Do you use sunglasses and sunscreen when you're outside in the sun?
Oh, yes, I do.
Okay. Do you have any smoke detectors that are working at home?
Yes.
Okay. And do you do a self breast exam every month?
Yes, I do.
Okay. How about, do you keep any guns or bullets at home?
No, I do not have guns.
Okay. All right. And do you um, do you um, do you exercise?
Yes, I do.
You exercise, all right. How often do you exercise?
Once or twice a week, depends on how lucky I get.
Okay. Why don't you exercise more?
Because I have school and work, so it's a little bit busy for me, and I just find time to try to exercise.
Right. And what do you do when you exercise?
I do cardio, strength training, and core.
Okay. And how long are each of these sessions?
About 20 minutes, if on a good day, 20 minutes each for each section.
Okay, good. So in total, how long is your
1
exercise
hour.
session?
1 hour.
Each exercise session lasts an hour. Okay, good. All right. Let's keep this going. How about, let's talk about your diet. How would you describe your diet? How would you?
Very good.
Very good.
Mm-hmm.
Your appetite?
Healthy.
Healthy. Do you cook your foods or do you eat mostly fast food?
I just like fast food, so I cook my food all the time.
You cook your food? That's good. All right. Let's talk about your sleep habits. Do you have trouble sleeping?
No, I sleep fine.
Okay. Do you wake up feeling tired?
No.
Okay. Do you have insomnia?
No.
Okay, good. And how long do you sleep?
If I get lucky, I sleep about 7 hours.
Okay,
But
that's
I
good.
get 6 hours.
All right, that's good. And what about your bowel patterns? What's your bowel pattern like?
You mean if I go to the restroom pool? Oh, I do that every day, morning and night sometimes, but mostly mornings.
Okay, good. All right. That's really good. Now, I want to ask you about your family. Let's talk about your family history.
Okay.
So let's talk about your dad. Is he living, and does he have any current medical history?
He's alive, no medical history. He's healthy.
Okay. How about your mother?
My mom passed, no medical history.
I'm sorry to hear about that.
It's okay, thank you.
What happened with your mom?
She had a car accident.
She had a car. She was involved in a car accident.
Yeah.
I'm sorry to hear about that. And how old was she when she passed?
She was 45.
45. Okay. Now let's talk about your siblings. Do you have any siblings, brother or sisters?
Yes, I have a brother and a sister. We're pretty healthy, no medical history. We rarely go to the hospital for
Okay.
anything.
All right, good. And then what about your grandparents? So let's talk about your paternal side, your paternal grandmother.
My paternal grandmother died of old age. She was like 103 when she died. And my paternal grandfather died about 98. I think they died of old age. No medical history for both of them.
Okay. And then what about your maternal grandfather?
My maternal grandfather died at the age of 100. No medical history. My maternal grandmother died at the age of 98 as well. No medical history.
Wow, your grandparents lived really long.
Yes, they did.
Well, maybe that explains why you're pretty healthy as well.
I guess.
It runs in the family.
Good genes.
Good genes, good. Have you recently had any travel or sick contacts?
Oh, no.
Okay, in the last 30 days?
Mm-mm.
Okay, good. And have you been hospitalized for psychiatric reasons before?
Oh, never.
Okay. So do you pretty much, I'm saying, like, have you been diagnosed with depression, anxiety, maybe suicidal ideation or homicidal ideation before?
None of the above, no.
Okay, all right. What about for psych emergencies?
No.
Okay, none of that.
Mm.
All right, good. Now let's talk a little bit about your social history. Do you drink alcohol?
No, I don't.
Okay. What about tobacco? Do you use any tobacco products?
No, I don't smoke. I don't chew tobacco. I don't do anything.
You don't smoke cigarettes. All right. What about marijuana? Do you use marijuana?
No.
Okay. What about other recreational drugs?
No, never.
Okay. Cocaine, any of that? All right. Good. And then, have you injected drugs before?
Oh, never.
Okay, never. And how about have you used someone else's drugs before?
No.
Okay. All right. Good. And the next thing I'm going to ask is I want to find out more about let's see your do you have any children?
Oh no, I don't have children. I'm just focusing on school right now and my work. No
I
children,
understand
okay.
that. So I'm going to ask you questions about your entire body now. If you have any recent history of any of these things, okay?
Okay.
Just let me know. Have you recently had headaches?
No headaches.
Any dizziness?
No dizziness.
Okay. Any lightheadedness?
No.
Okay. How about any nasal discharge?
No nasal discharge.
Okay. Any rhinorrhea or runny nose?
No.
Okay. How about any ear pain?
No ear pain.
Okay. How about any ear discharge?
No ear discharge.
Okay. How about any eye pain?
No eye pain.
Okay. How about any conjunctivitis?
No.
Okay. How about any eye discharge?
No.
Okay. Eye infection?
No.
Nasal or nose infection?
No.
Okay. How about ear infection?
No.
Okay. How about alopecia?
No.
Okay. Or hair loss?
No.
Okay. How about any sore throat?
No.
Any mouth sores?
No.
Okay. How about any gum or dental problems?
No.
Okay. How about any heat or cold intolerance?
No.
Okay. How about any excessive thirst,
No.
excessive hunger,
No.
or excessive urination?
No.
Any painful urination?
Never.
Okay. Any dysuria?
No.
Okay. Any blood in your urine?
No.
Any blood in your sputum?
No.
Okay. How about any blood in your stool?
No. Never.
Okay. Any anal or rectal bleeding?
Mm-mm.
Okay.
No.
How about any myalgias?
No.
That's like pain in your body.
Oh no.
Any back pain?
Oh no.
Okay.
No.
Any muscle aches?
No muscle aches.
Okay. Any fever?
No fever.
Okay. How about any migraine headaches?
No migraine headaches.
Any chills?
No chills.
Okay. How about any night sweats?
No night sweats.
Okay. Any fatigue?
No.
Tremors?
No.
Nervousness?
No.
Okay. Anxiety?
No.
Depression?
No.
Okay. How about any vaginal pain?
No vaginal pain.
Okay. How about any spotting?
No spot.
No spotting. How about any abnormal discharge in the vagina?
None.
Okay. How about any genital sores?
No sores.
Okay. Then let's talk about your heart and your lungs. How about any chest pain?
No chest pain.
Chest discomfort?
No.
Chest tightness?
No.
Palpitations?
No.
Leg swelling?
No.
Okay. How about any shortness of breath?
No shortness of breath.
Okay. How about any trouble breathing?
No.
Any increased effort to breathe?
No.
Do you find yourself propping up pillows at night to sleep
Oh no.
because you couldn't breathe?
No.
Do you find yourself leaning forward to breathe?
No.
Do you find yourself waking up in the middle of the night because you couldn't breathe?
No.
Okay. Have you found any lumps or masses anywhere in your body?
While examining my.
Just anywhere else? Doesn't matter. Anywhere.
No.
No? Okay. How about any lumps in your neck?
Oh no lumps.
Okay. No swollen lymph nodes?
No swollen.
Okay. All right. You said you do check your breast every month. You
Yes,
do
I
your
do.
self-breast exam every month. Okay. Have you found any excessive hair growth anywhere in your body?
No.
Okay. How about, do you have any gait problems? Meaning, like, you sometimes maybe feel like you want to fall. You have you have shuffling gait. You feel like you need to fall. You want to fall over.
No. Fine.
Okay. Any syncope or fainting?
No.
Okay. Any tremors?
No.
Okay. Do you sometimes have joint deformities or joint pain?
My joints are fine.
Okay. Any bone bruising?
No bone bruising.
Okay. Any easy bruising or bleeding?
No, none.
Okay. All right. How about any immunocompromise?
Does that have to do with vaccine or what?
No. That's pretty much just if you have very low immunity
Oh
or
no, I'm
if your
fine.
immune system is not that great.
No, my immune
Okay.
system is great.
All right. Speaking of vaccinations, I never asked you, but did you get your vaccine? Are you up to date with your vaccination?
Oh yes, my Tdap, my MMR, varicella, COVID vaccine, and flu vaccine. I got everything.
Oh, really? When did you get those?
I got my COVID vaccine recently, 2 weeks ago. Flu vaccine about 2 months ago when I got all my Tdap and varicella just for school.
Right. Oh, that's good. So you're up to date with your
Yes,
vaccinations.
I am.
That's really good. So I think that pretty much sums up all of the questions I need to ask you for review of systems. So what I'm going to do now is I'm going to go on and do a quick general survey of your skin
Okay.
and your entire body. So I'm looking at your skin right now, and as I'm looking at her skin, I notice that the symmetry. So everything looks very symmetrical, meaning that what's on the left side equals what's on the right side. There's no asymmetry, which is a good finding. It's a normal finding. I'm looking at your skin. I'm feeling your skin. I can see the color. The color is normal for ethnicity or race. It's nice and warm. I'm even looking at the way you're dressed. You're dressed appropriately for the occasion. You're also dressed appropriately for the weather.
Thank you.
Your air distribution looks normal. I can see it from here. You smell really good. You have really good hygiene. Your posture and your stature looks good. You're well dressed, like I said again. Skin is good. The turgor is good. The elasticity is good. It's nice and supple. I can tell you're well hydrated. That's what that means.
Thank you.
And good moisture for your skin as well. And your skin feels good. Like I was saying, there's no diaphoresis. Your palms don't feel cold and clammy. So I can tell you're not nervous. She's nice and pleasant. And she's also not in any apparent distress and she doesn't appear to have any apparent discomfort right now. I can feel your breathing. Your breathing is nice. You're not using any accessory muscles to breathe, which is good. So you're not like working up to breathe. You're not using your accessory muscles to breathe. So your breathing looks great. So that's my general survey right now. So I'm done with the skin or the general survey. So what I'm going to do now is I'm going to start with the head and I'm going to move down all the way to the toe for the physical assessment. Okay. All right. So for the head, first thing I'm going to do is inspect, and I just did that. I said the hair distribution looks great, color looks nice, hygiene is good. So then I'm going to palpate. Okay.
Okay.
So palpating the head, what I'm palpating for any lumps, any masses, any lesions, any scars, and I don't feel anything. So I'm palpating for also alopecia or anywhere in your head where there's like a patch of hair loss, and I don't see, or the hair distribution is perfect. It's very normal. And while I'm here, I'm also just palpating the mastoid. So I'm palpating the mastoid. That's the bone for your ear. Does that feel tender?
No.
Okay. When I was palpating your head, was there any discomfort or tenderness?
No.
Okay. Please let me know during the exam if you feel any comfort,
Sure.
any discomfort or any tenderness. Okay. All right. So I'm palpating the mastoid. Feels good. All right. So the head, that's normal. All right. That's good. So while I'm here, I'm also just palpating for the lymph nodes. So palpating for the lymph nodes, I'm starting with the post-auricular, pre-auricular, where the tragus is. As I'm palpating the tragus, does that hurt?
No.
Okay, all right. I also palpated the ears, the pinna. Does that hurt?
No.
Okay. All right, good. And I'm palpating down to the submandibular lymph nodes. I don't feel anything. The submental. And then I'm going to the anterior cervical and then posterior cervical. And I'm also palpating for the supraclavicular and the infraclavicular. I don't feel any lymph nodes, which is normal. Okay? So what I'm going to do now is I'm going to test your cranial nerve number 7. That is the facial nerve. Now to do that, what I'm going to have you do is I'm going to have you raise your eyebrows all the way. Raise your eyebrows. Good. It's symmetrical. And then you can lower them. Then I want you to close your eyes and close it tight. I'm going to try to open your eyes. I'm testing the muscles because it's a motor component. Okay, I can't open it, which is perfect. Now I'm going to have you smile and then frown. Okay, symmetrical. And then also puff out your cheeks and don't let me get through. Okay, good, good. So she has really strong muscles for the facial nerve number 7, which is telling me that that's intact. Now while we're here, we might as well just palpate your TMJ, which is the temporal mandibular joint. So I'm going to have my finger here, my hand here. Go ahead and open your and close your mouth a couple times. Okay. What I was checking for was to check for if there's any popping, any pain, any clicking, and any locking. I didn't feel any of that. Was there any pain as I was palpating?
No.
Okay. So now while we're here, there's cranial nerve number 5, which is a trigeminal nerve. We might as well just go ahead and deal with that. So the motor component of that is the lower jaw. To assess for that, can you move your lower jaw left to right? Good. Symmetrical. And then I'm going to also have you clench your teeth down. Clench it down, put your head straight, and clench your teeth down for me. So I'm going to feel for the muscles of chewing, the mastication muscles, the masseter and the temporalis, and they're both normal. So that's for the cranial nerve number 5. All right, good. So what I'm going to do now is I'm going to inspect your nares, and let me go grab my otoscope. I'll be right back. So for the nares, I just need to look into your nose. All right. So go up a little bit so I can look into your nose. Okay, looks normal. All right. So what I was looking for as I was doing that was I was looking at your mucous membrane. It was nice and pink and moist. And then I was also looking at your septum. It wasn't deviated. And your turbinates look normal as well.
That's good.
Okay. Now I'm going to palpate your sinuses.
Okay.
So let's start with your frontal sinus. Any pain?
No pain.
And then your ethmoid sinus. Any
No
pain? And then your maxillary sinus.
No pain.
All right, good. So those are the sinuses. Now I need my otoscope, my ophthalmoscope for the eyes. I'm going to inspect your eye and then test or assess your eyes, okay?
Okay.
All right. So for your eyes, I want you to look straight at me.
Okay.
I'm going to inspect. What I'm inspecting for, I'm looking at your eyelids. I'm looking at your eyelashes. The air distribution is normal. I'm going to actually look at your sclera. So can I have you look down? And I'm going to raise this up. Okay, your sclera is white. Perfect. And I'm going to check your conjunctiva as well. Nice and pink and moist. Good. I'm looking at the iris. I'm looking at the pupils. Your pupils are about 4 millimeters. Okay. So your iris, your cornea, all of that. I don't see any eye drainage. I don't see any eye discharge. I don't see any eye redness. You don't have a bloodshot eye, which is normal. I don't see any lacrimal drainage. So that's good. So now I'm going to assess for some cranial nerves. Okay. So I'm going to assess for cranial nerve number 2, cranial nerve number 3, 4, and 6. Okay. So to do cranial nerve number 3, 4, and 6, I'm going to actually do the pupillary reaction to light, but let's do the cranial nerve number 3 first. Can I have you stand up? Because it'll be easier to do this with you standing up. So what I want you to do is, okay, so stand right there. And I'm going to have you keep your head still and just move your eyes, okay?
Okay.
And follow my finger with your eyes, okay? All right. So what I'm doing here is I'm checking for nystagmus or strabismus. Okay, strabismus is if she has any lazy eye, and nystagmus is if there's any disconjugation. So then I'm going to move this in all the cardinal gazes. So I'm checking the visual fields. So I'm going to do the rectangle motion. And I'm looking at her eyes for any nystagmus. All right, good. So that was good. I just checked your EOMs, which are your extraocular muscles, and they're all intact. So the cranial nerves 3, 4, and 6, same intact. Now for cranial nerve number 2, I'm going to test two things. I'm going to do the central vision and the peripheral vision.
Okay.
All right. So for central vision, I need my Snelling chart. So I'm going to have this 6 feet away from you, and I want you to read the last line for me if you can, and cover one eye.
Okay. LTFPH.
Perfect. And then cover the other eye and read the last line again.
LTFPH.
Okay, good. So that's the 20/20 vision. You were able to do that perfectly. So both eyes 20/20, left eye 20/20, right eye 20/20, and both eyes 20/20. So that's for central vision. Now for peripheral vision, I want you to cover one eye, and I'm going to cover the same eye. I'm going to cover my eye on the same side. So I want you to tell me when you can see the fingers wiggling.
Now.
Okay, good.
Now.
Okay, good.
Now.
Good. And then?
Now.
Good. So keep focusing on my nose, okay?
Okay.
All right, let's cover the other eye now. I'm going to do the same thing.
Now.
Okay, good.
Now.
Good.
Now.
Good.
Now.
Good. So that's the test for peripheral vision. And we're able to do that. You okay?
Yes.
We're able to do that perfectly. All right? So you can go ahead and have a seat.
Okay.
So the next thing I'm going to do is I'm going to check for pupillary response. Okay?
Okay.
Oh, right here. My stuff is right in my ophthalmoscope. So for pupillary response, what I need to do is I need to shine this light in your eyes. Okay? So again, I'm going to check for pupillary response. So I'm going to look in your eyes. Going to see if there's any pupillary response. Okay, so that's direct and also direct pupillary response. So I can see your pupils constricted from 4 millimeters to 2 millimeters. Now I'm going to do consensual pupillary response. So I'm going to shine this to your right eye and look at your left eye. Your left eye should constrict. And yes, it did constrict. And do the same thing on this side. Yes, your right eye constricted. So direct and consensual pupillary response to light were normal. From 4 millimeters to 2 millimeters, the pupils were round, reactive to light with, so it was round, it's pearlized. So its pupils were equal, round, and reactive to light. Now the next thing I need to test is convergence and accommodation.
Okay.
So with convergence and accommodation, can I just stand up again?
Okay.
So I'm going to have this finger here near, and this finger is far. I want you to focus on the far finger. Okay, I'm looking at your eyes diverged, and your pupils actually dilated. That's pretty good. And then look at the finger that's near you. Oh, good. Your pupils just converged, and your pupils constricted, and your eyes converged. Look at the far finger again. Nice. And look at the finger that's close to you. That's good. So what I was able to elicit was that your pupils converged, your pupils constricted, and your eyes converged with this near finger, and your pupils dilated and your eyes diverged with the far finger.
Oh.
So I was able to test convergence and accommodation.
Okay.
All right, good. So now I'm going to look at your ears. All right.
Okay.
For your ears, first thing I'm going to do is I'm going to look into your ears. I'm going to test to just inspect and palpate for symmetry. I'm looking at the pinna. I'm looking at the auricles. Any pain here as I'm touching? Okay. And I already palpated your mastoid before.
Mm-hmm.
Any pain with the mastoid?
No.
No. Good. So now I'm going to look at your ears. Okay. I need to grab another piece here to look at your ears. So I've looked at your ear placement, everything looks normal. So looking into your ears, all right. So I'm gonna pull your ear up and back.
Ouch.
Oh, is it okay?
Yeah.
Oh, I'm sorry. Sorry about that. Okay. Your ears look normal. No drainage, just a little bit of wax. All right, let me look at the other side.
Okay.
Put your ear up for me a little more. Yeah,
Okay.
thanks, that's why. Okay, put it up and back. All right, good. Just a little bit of serum and a little bit of wax.
Okay.
So when I was looking at your ears, I did not notice any drainage. I did not see any redness. There was no sign of infection. What I saw was the canals. The canals look patent and normal. A little bit of earwax, which is normal, is protective. And your tympanic membrane, the eardrums, were translucent. They were pearly gray, and the cone of light were visible on both sides. On the right side, it was at 5 o'clock, and the cone of light was at 7 o'clock on the left side.
Good.
All right. So let's test for hearing now. I need my tuning fork. Okay. So for the hearing, I'm going to use the tuning fork. Okay. So what I'm going to do is I'm going to hit this on my hand. All right. And when I do that, I'm going to put this on your forehead. That'll be for the Weber test.
Okay.
And the Rene test, I'm going to test bone versus air conduction. All right. So for the Weber test, I want you to tell me if you feel the vibration on one side, on both sides.
Okay. I feel it on both sides.
Both sides. Good. So that's the Weber test for hearing. And these are for the cranial nerve number 8. Okay. Now for the other test, the Rene test, I'm going to put this on your mastoid first, and then I'll put it next to your ear, about 1 to 2 centimeters from your ear. So let me know when you start feeling this.
Now.
Okay? Let me know when you stop hearing this.
Now.
Okay, good. So that was normal because air conduction is greater than bone conduction. I'm going to do the same thing on this side.
Now.
Okay. And
now.
okay, good. So your cranial nerve number 8, the acoustic nerve, is intact. All right. So before you sit down, I want to go back to what we did with the trigeminal nerve.
Okay.
So I tested the motor components, which was I had you do your jaw, and I also had you clench down your teeth. What I forgot to do was I forgot to test for the sensation part of the trigeminal nerve. And so to test for the sensation, I'm going to have the sharp and dull.
Okay.
And I want you to tell me if there's any symmetry, meaning if the stimulus is the same. So I'm going to use your forehead, your cheek, and your chin. All right? If it's the same or if it's different. All right?
All right.
Okay. So please close your eyes.
Sharp.
Okay.
Sharp. It's the same.
Okay.
Dull. Dull feels the same.
Okay.
Sharp. Sharp feels about the same.
Okay. Good. All right. So we're done with that part. I remember that, and then I did your ears as well. So now let's move to the mouth. I was gonna do the nose, but I already did the nose before. I inspected with the otoscope. The only thing that I probably forgot with the nose is to inspect the nares for patency. So to inspect the nares for patency, can you cover one nose and then breathe in and out? Okay, good. That seems pretty patent. And cover the other nose and do the same thing. That's pretty good. So that's pretty patent. Now for the mouth, can I have you open your mouth? Okay. So okay, open your mouth for me. All right, good. Say ah.
Ah.
All right, good. So I'm looking at your oral pharynx. I looked at your buccal cavity, and what I saw that there was no cobblestoning in the posterior oral pharynx. I also noticed that, as you said, your uvula rose and elevated normally and centrally. Your soft palate also rose and elevated normally and centrally. I didn't see any gum disease. I didn't see any gum damage. I didn't see any swelling. Your teeth, your dentition looks normal.
Thank you.
Your mucous membranes look nice and pink and moist. So you have a nice mouth.
Thank you.
Now, while we're in the mouth, we can test for cranial nerves number 9 and 10.
Okay.
So cranial nerve 9 and 10, I actually just tested for them when I ask you to say ah. So saying ah and saying that your soft palate was rising and elevating normally and centrally, that's a test for the cranial nerve 9 and 10.
Okay.
Another test for them is the gag reflex. But I'm not going to elicit a gag reflex today. But I know you do have a gag reflex. So that will be for cranial nerves 9 and 10.
Okay.
And can I have you cough? That's cranial nerve 10. Okay? The fact that you can do that, that's cranial nerve 10. Now, since we're in the spirit of cranial nerves, let's continue with cranial nerve 12. That is your tongue. So can I have you sting your tongue out? Okay, can you move it up, down, left and right? Okay, so that's telling me that the hypoglossal nerve is intact. All right. Now, I'm going to do your cranial nerve 11. So for the cranial nerve 11, I'm going to do the shrug test. So I'm going to put my hand on your shoulders and I want you to shrug. Okay, good. You can put it down. You're pretty strong. So that was a muscle strength test for the trapezius and you passed it. Now, also for the sternocleidomastoid, can you just move your hand and move your head against my hand? Good. And on the other side. Okay. So that shows that you have really strong sternocleidomastoid muscles, the neck muscles that are here.
Oh.
Right? Okay. So that's for all the cranial nerves.
Okay.
So we're done with the mouth. The neck. We did the neck because I checked the lymph nodes earlier and I was able to palpate no lymph node. So that tells me that your neck is pretty good. The only thing about the neck that I need to do now is to test your thyroid to see if you have any thyromegaly. So can you turn a little bit away from me?
Okay.
So I'm going to come down here. And what I'm going to have you do is, so I just found it, the thyroid, where the thyroid should be. I just found it at the anatomical location. It's below the cricoid. So can I have you swallow? Okay, and then swallow again. Okay, good. So I didn't feel any thyroid. There's no thyromegaly. So that's for your neck. So now let's move to the chest, the lungs, and we'll do the cardiac as well. So for the chest, first thing I'm going to do is I'm going to inspect. So I'm inspecting, and I'm looking at the anterior chest. I'm looking for how you're breathing, your effort of breathing effort, and breathing effort is normal. You know, I cannot hear any stridor. I don't hear any wheezing, so which is normal. I'm also looking at your chest. I'm looking at your chest. Your chest rise and chest fall. It's symmetric, which is good. And I'm also going to look at your posterior chest as you're doing that, so I can look at both at the same time. Your posterior chest also looks normal. I'm looking at your spine as well. Looks like your spine has a normal S curvature. I don't see any kyphosis. I don't see any lordosis. I don't see any scoliosis. So I don't see any, the alignment of the spine looks normal. And I'm looking at the anterior posterior diameter compared to the transverse diameter, and it's about a 1 to 2. Anterior posterior to transverse diameter is about a 1 to 2. I don't see any pigeon chest or any funnel chest, so that's normal. So the next thing I'm going to do now is I'm going to auscultate, okay? I'm going to actually start from the front. So to auscultate, I need my stethoscope. Let me grab my stethoscope here. So with my stethoscope, I'm able to find that, you know, I'm going to find more about your breathing, all right? So before I do that, I'm actually going to start from the front. So let me start from the front. I will turn towards me a little bit here. All right. So I'm going to start with the sounds, the breath sounds. The first one I'm going to do is called the bronchial sounds. These are the sounds that I heard over the trachea. So just open your mouth a little bit and breathe through your mouth. Okay, and then the other side. Pretty good. And while I'm here at the neck, I might as well just check for the carotid bruit. So please hold your breath, and I'm going to use my bell to auscultate for the carotid bruit. Okay. All right, no carotid breathing. Also, continue to hold your breath. I'm going to feel for a thrill, carotid thrill. Okay, no carotid breathing, no carotid thrill. So let's continue to auscultate. So I'm going to auscultate for more breath sounds. These are bronchial vesicular breath sounds. Take the breaths for me, in and out. Take the breaths for me, in and out. So as we get into the periphery, it becomes vesicular breath sounds. Okay, now I'm going to move to your back. For your back, the top of the lungs has the bronchovesicular breath sounds as well. And then bronchovesicular. Then as I get to the periphery, it becomes vesicular breath sounds. Alright, your breathing sounds normal. So what I'm going to do next is I'm going to palpate for tactile parameters. Okay? So I just want you to say 99 as you feel the bottom of my palms on you.
99, 99, 99, 99, 99, 99, 99.
And then your anterior part as well.
99, 99, 99, 99, 99.
Good. And the vibrations felt normal when I was doing that. To go back there again, the posterior side, I'm going to do respiratory excursion. Okay, so I'm going to right by the diaphragm area. I'm going to have you take a couple deep breaths. Another one. So as I did that, I noticed that my thumb moved out of your midline equally and symmetrically, which tells me that your chest expansion is normal. And then I'm going to do diaphragmatic excursion. So for the diaphragmatic excursion, what I'm going to do is I'm going to have you take a deep breath and hold. Okay, I'm going to palpate. I'm going to percurse from tympani to jaw. Okay, go ahead and breathe normally. And then go ahead and exhale out. And then I'm going to percurse up. Okay, go ahead and breathe normally. So I went from tympani to jaw, and this is about 4 centimeters. Normal diaphragmatic excursion is from 3 to 5 centimeters. I'm going to do the same on the other side. Can I have you take a deep breath in? Take a deep breath in and hold. All right, good. So, okay, that's jaw. Okay, and tympani right here. Then go ahead and breathe. And exhale and hold. Then let's go from here. Tympani. Jaw. Go ahead and breathe normally. That's also about 4 centimeters, as you can see. So that's normal diaphragmatic excursion. Then one last thing I'm going to do is I'm going to check for CVA tenderness. CVA tenderness tells us if you have any kidney infection, any pyelonephritis. So I'm going to just, right where the kidneys are, I'm going to do a little blow and let me know if it's tender.
Okay. Not tender.
All right, good. So your CVA tenderness is negative. Go ahead and have a sit.
Okay.
All right. So now we're going to test your cardiac. So to do the cardiac, the first thing I'm going to do is I'm going to check your pulses, your peripheral pulses. So I'm going to test your radial pulse. I'm testing the rate and the rhythm. I'm looking to see if it's boundy, if it's thready, if it's weak, or if it's just normal, 2+. And yours is normal 2+. I don't notice any pulse difference. Feels normal. Okay? And then I'm going to check your brachial pulse. Also feels normal. I'm gonna check your popliteal pulse. Relax your legs. Okay, feels normal. Your tibial pulse, also 2+ and normal, bilaterally. And then your pedal pulse, dorsalis pedis, 2+ and also normal. Okay, all of your peripheral pulses are normal. Now what I'm going to check is your PMI, called the point of maximal impulse. Can I have you lay on your left side, please?
Okay.
All right. And then what I'm going to do, I'm going to palpate for the PMI. So I'm going to have you lean forward a little bit. And I'm going to palpate for it. Oh, it's right there. And it's at the apex of the heart. That's where the mitral valve will be auscultated. And I can palpate the PMI. I'm actually going to listen to it as well while I'm there. Okay, I can hear it. I can hear the heartbeat. Okay, so go ahead and sit up. So what I'm going to do now is I'm going to auscultate for the valves. I'm going to start with the diaphragm and then I'm going to go to the bell. Oh, sure, you can stand. Thank you. All right, so I'm going to start from the second intercostal space. Right sternal border, that's the aortic valve. And then second intercostal space, left sternal border, that's the pulmonic valve. Okay, and then third intercostal space, left sternal border, that's the Erb's point. And then fourth intercostal space, left sternal border, that's the tricuspid valve. And then fifth intercostal space, mid-clavicular line, that's the point of maximal impulse that we just talked about. That's also where you would, yeah, that's the mitral valve. Okay, and I'm going to do the same thing with the bell. Okay, so second intercostal space, right sternal border, aortic valve. Then second intercostal space, left sternal border, pulmonic valve. Then third intercostal space, left sternal border, Erb's point. And then fourth intercostal space, left sternal border is tricuspid valve. And then fifth intercostal space, mid-clavicular line. That's again this point of maximal impulse and the mitral valve. All right, good. So that's for your cardiac. Now, that thing I'm going to do with the cardiac is check your jugular vein pressure.
Okay.
So to check your jugular vein pressure, I'm going to have you lie this way,
Okay.
supine, no pillows,
Okay.
because I need to find the jugular vein first. So can I have you turn your head to your left? So what I'm doing here is I'm trying to expose the patient's, and I can see it already. I'm trying to expose her jugular veins. So normally I should be able to find, it would have been better to use the internal jugular vein, the right internal jugular vein, but that's usually the person we're going for the more superficial vein, which is the external jugular vein. So with the external jugular vein, I can see it pulsating here, I can see the apex. So because I've seen it, I'm gonna grab a ruler and a piece of paper. Okay. So with the ruler and a piece of paper, I can then have the patient go to about 30 to 45 degrees. Maybe one more pillow. Alright, there's the one more pillow. Alright, go ahead. Perfect. So about 30 to 45 degrees. Alright, okay. So I see now that the pressure and the pulsating is starting to decrease. So I have my ruler here in centimeters, and then I have my piece of paper here to help me get a horizontal plane. So I'm going to find the sternum. We know that the distance from the right atrium to the sternum is about 5 centimeters. What we're doing here was we're calculating for the JVP, the jugular vein pressure, which we know is very approximately the central venous pressure in the right atrium. So I found the sternum. That's going to be my landmark point. And I've also found the apex of the external jugular vein, the right external jugular vein. So I'm going to go from the apex of the right external jugular vein right to the ruler, and looking at it to the sternum, it's about 1 centimeter. So 1 centimeter plus the 5 centimeters is called 6 centimeters. So you have 6 centimeters of water pressure, and that's normal because it's usually between 4 to 10 centimeters of water. So your jugular vein pressure is normal, and that's the approximate number for your CVP, which is central venous pressure. All right, good. One last thing to do while we're here for cardiac is you can sit up now.
Okay.
I'm going to look at your nails, and I'm just checking for any clubbing. I'm looking at the nails, the color of the nails. I'm looking at the shape, the contour. It looks normal. And I'm going to check your capillary refill. That's the circulation status. Okay, it's less than 3 seconds. Perfect. Now let's do your abdomen. Can I have you lay back down?
Okay, that's fine.
Yes. And you can put the pillow on you now. Okay. And just expose your abdomen. Just your abdomen. Okay, thank you. So for the abdomen, first thing I'm going to do is I'm going to inspect. So I'm going to look from this side. I'm looking for symmetry. I'm looking for contour. Looking from the end, symmetry and contour. And our abdomen looks flat. It's not distended. I don't see any engorged veins. I don't see any striae. I don't see any scars. I don't see any hernias. No distortion, no distended abdomen. Perfect. I can even look over the belly button, the umbilicus, and also symmetry wise, it's great. So next thing I'm going to do is I'm going to auscultate. After inspecting the abdomen, you have to auscultate. So I'm auscultating for bowel sounds. I'm going to go in a clockwise fashion, and it should take 5 to 10 seconds. I go from the right lower quadrant to the right upper quadrant, then to the left upper quadrant, and to the left lower quadrant. And I can hear some chuckling and gurgling, and that must be gas or fluid in your intestines. So next thing I'm going to do is I'm going to auscultate for brewing. So let's start with the abdominal aorta using my bell. Okay, I can hear the aorta just, I can hear the circulation, but there's no brewing. Then let's go to the renal arteries. Okay, right and left renal artery. Then the right and left iliac arteries. Oh, okay. Nice. And then your right and left femoral artery. Good. Just normal blood flow. There's no turbulent blood flow. So that's good. So after auscultating, the next thing to do is to percuss. So we're going to percuss. What I'm percussing for is the hollow organs will be tympani, and then the solid organs will be dull. So as I get close to the liver, for example, see that's
Dull.
nice and dull, right? And then I continue to move its tympani. Now, if your bladder was full, or you had something in your sigmoid colon, like some stool, oh yeah, that's kind of dull.
Does that mean I want to poop?
Maybe you have something in your you have something in your sigmoid colon. Oh, your bladder is not full.
No.
Okay, good. All right. So, actually, if we wanted, we could measure the liver border. So it looks like it's about 7 centimeters, and should be between 6 to 12 in a normal adult. So that's good. So that's how you percuss for organs. So next thing we're going to do is going to do some palpation. So I'm going to start with like a light palpation. Now I'm going to ask, before I even continue palpating, is there any pain or discomfort in your stomach?
No pain, no discomfort.
Okay, all right. So as I palpate, I'll be looking at my patient to check to see if there's any guarding. Now, if she says she had pain anywhere, I'll be palpating that part last, because you don't want your patient guarding. You want them to be able to relax and give you as much leeway to do as much palpation. Okay, so I'm going in a clockwise fashion. Okay, that's my light palpation. I'm going for a deep palpation. When I did my light palpation, I was palpating for masses, I was palpating for lumps. When I do my deep palpation, I'm also still palpating for masses and lumps, but mostly I'm palpating for organomegaly. So any large or enlarged organs. Sometimes you find splenomegaly or hepatomegaly on palpation. Okay, so nothing here. Any pain or discomfort as I was doing that?
No.
Okay, now I'm going to palpate for the liver. The liver is in the right upper quadrant, so I'm going to start from your right lower quadrant and palpate up deep. So take deep breaths for me, in and out. Okay, so on inspiration, I'll go a little deeper. On inspiration, I'll go a little deeper. Okay, I'm trying to see if I can feel the edge of the liver. Okay, I don't feel it. Sometimes you feel it, sometimes you don't feel it. Now I'm going to also palpate for the aorta. So for the aorta, it's right in the middle here, like in the epigastrium area. So continue to take deep breaths for me. So on inspiration, I go deeper, and I don't feel anything, which is good. Usually why we like to palpate the aorta is sometimes we want to rule out if there's any abdominal aortic aneurysm. And so what you would palpate would be like a bulging or a pulsating mass. Oh, I don't feel any of that. Now, I'm going to do a bimanual exam to palpate for the kidneys. Go ahead and continue to take deep breaths. So I'm feeling for the right kidney, which should be right underneath the liver. So the right kidney is actually located a little lower than the left kidney. Okay, I think I feel it. All right, now let's do the left kidney as well. Go ahead, continue to breathe. Okay, deep breaths on inspiration. All right, I think I feel it too. So you have really, I could feel your kidneys. Was there any pain as I was doing that? Any discomfort?
No discomfort.
Okay, good. So next thing I'm going to do is I'm going to do some tests, some signs. The first one I'm going to do is to elicit if you have an inflamed gallbladder, an infected gallbladder, cholecystitis, and we call that the Murphy sign. So with the Murphy sign, I'm going to lift your leg up. So I'm going to flex the leg at the hip and at the knee. So it's about 90 degrees. All right. And what I'm going to do is I'm going to do an internal rotation of the hip. Okay. Internal rotation of the hip. So what I'm doing here as I'm doing that, it's actually, this is not the Murphy sign. This is the obturator sign. I'm sorry. This is the obturator sign. So this obturator sign, this is for appendicitis. So there are two signs for appendicitis. This is the first one. So for the obturator sign, I'm going to do the internal rotation of the hip. Okay. So what I'm doing here is, as I'm doing the internal rotation of the hip, I am trying to get the internal obturator muscle to stretch. And when it stretches, if she actually indeed have an inflamed appendix, that stretched muscle, the internal obturator muscle, will irritate the appendix and cause her some pain in the right lower quadrant. So let me know, do you have any pain as I'm doing this?
No.
Any pain?
No.
Okay, good. So that's the obturator sign, negative obturator sign. While we're doing the appendix, let's go ahead and also do the psoas sign. So the psoas sign, I'm going to have you lay on your left side. And the psoas sign, we have the iliopsoas group of hip flexors. So this iliopsoas group of hip flexors, when they are stretched, they are also close to the appendix. So if your appendix was inflamed, it would irritate the inflamed appendix. So what I'm going to do is I'm going to extend the leg at the hip. So I'm going to extend, just hip extension is what I'm doing. So right now I'm stretching those muscles, the hip flexors, the iliopsoas muscle. Any pain in your right lower quadrant?
No.
Okay, good. So that's a negative psoas sign. Now let's do the Murphy sign. So the Murphy sign, can I have you go back on your belly? And go back on your back. So the Murphy sign is, we're going to apply pressure to the right upper quadrant. This is where the gallbladder is located. So I'm going to find the right costal margin here, and I'm going to continue taking deep breaths for me, please. So as I'm going a little deeper, So continue to breathe. Right. If she indeed does have an inflamed gallbladder, on inspiration she will feel some pain. Go ahead. As my finger gets close to where the gallbladder is, she will feel some pain. Any pain with that?
No.
Okay. So there's no pain, there's no discomfort. That gives us a little bit of perspective of what those signs are for the abdomen. Now you can actually sit up now. So what I'm going to do now is I'm going to do the NURU test.
Okay.
So for the NURU test, we've already done all of the cranial nerves, it looks like. So what we're going to do next is we're going to do some more cerebral function test. Okay? So for the cerebral function test, I'm going to start with you doing the finger to nose. So I want you to put your finger to your nose and then touch my finger. Okay? And then do the other side too. Okay? Okay? So I'm changing the visual fields just to confuse the patient, but a cerebellum should be able to handle it. Okay, good. Now let's do rapid alternating movements. Okay, good. Now let's stand up and let's do the rhombus sign. So the rhombus sign, you're going to face forward and close your eyes. So I'm checking for positional sense and trying to see if she sways, if there's any loss of balance here. There's no loss of balance, so you're good. So that's a rhombus sign, negative for rhombus. And now let's do the shallow knee bend. All right, good. Now let's walk. I want you to walk towards that camera and walk back. Okay, so that's normal tandem gait, normal walking. Now walk heel to toe. Good. Good. Then walk back, walking on your toes. Then walk back, walking on your heels. Okay, good. Now can I have you sit down and I want you to do a heel to shin.
Okay.
Slide. Okay, on the other side. All right, good. Cerebral function is normal. Okay? All right. So next thing I'm going to do is I'm going to test for some sensation.
Okay.
All right? So I'm going to test for sensation by, again, sharp and dull, okay? Just throughout your body, your full body sensation. So can I have you close your eyes and tell me if it's sharp or if it's dull?
Okay. Dull. Sharp.
Sorry.
Sharp. Dull.
Sorry.
Dull.
All right.
Dull.
All right, good. So she was able to elicit what the sensation was. She has really good sensation throughout her body. Now I'm going to also test vibration, okay? Close your eyes and I want you to tell me if you feel it. Can I have you? Yeah. On your bony prominence.
I feel it. I feel that. I feel that. I feel it.
All right, good. Okay, so now we're pretty much done with the NURU part. So what we need to do now, before I actually go, one more thing for the NURU, we need to do our deep tendon reflexes. So for our deep tendon reflex, I need to grab my reflex armor. Okay. So with the reflex armor, let me start with the biceps.
Okay.
All right. So I'm going to do it one side and do it on the other side. Good. Do it on this side too to compare. Good. And let's do your triceps. Oh, sorry. Good. Good. Then let's do your brachioradialis. Good. Good. Then let's do your patella. Good. Good. Then let's do your Achilles. For that, I want you to lay on the bed.
Okay.
Okay, with your foot hanging off the bed. All right. Good. Good. So while you're here, I'm going to do the Babinski. Good. Good. So she crawled down. She flexed down on her toes. And what that means is that what that tells us is that she doesn't have a upper motor neuron lesion. So that's good. You don't have any neurological lesion. So we're done with the neuro part. The last part of the exam is the musculoskeletal part. Okay. So the first thing I'm going to do is I'm going to inspect and palpate again. I've been doing this before. I inspected and palpated I inspected your musculature, but I'm going to do it again, almost like I'm looking at a skeleton. So I'm looking for symmetry. I can see it's very symmetrical from your head to your toe. It looks nice. So I'm going to palpate starting from your neck. Let me know if you feel any pain or any tenderness.
No pain.
Okay. No. Then your shoulders, any pain, tenderness?
No.
Elbows, any pain, tenderness?
No.
Your wrist?
No.
Okay. What about your fingers?
No.
Your hand?
No.
Okay. Then can you stand up? I'm going to palpate your hips. No?
No.
Okay. Then your hip, your knees?
No.
Okay. Then your ankles?
No.
Your tibia, fibula?
No.
Then your toes, your feet and your toes?
No. It
No.
feels like a massage.
I know, it feels like I'm massaging you. So what I'm going to do now is we're going to actually stand up for the rest of the thing now.
Okay.
So we're going to do some range of motion and some muscle strength.
Okay.
So we'll do the range of motion and I'll do one muscle strength for each part, okay?
Okay.
All right. So let's start with the neck. Let's do a neck flexion. Okay? The neck extension. Put your head back. Good. Then let's do a lateral flexion. Good. The other side. Good. And then let's do a rotation. Neck rotation. Good. Good. Now, let's do, since we're in the spine, let's do the thoracolumbar spine flexion. So that's like you bowing down. Good. And then I'm looking at your spine again. The alignment is great. Now, let's do extension. Bend back. Good. Wow. You have pretty good extension. You're flexible. Are you a dancer?
Yes, I used to be.
Oh, good. Then let's do lateral flexion. Good. The other side. Then let's do a rotation of the thoracolumbar spine. Good. Right. She's pretty flexible. So now let's move to the shoulders. Let's do a shoulder flexion. Good. Then let's go back to midline. And then let's do a shoulder extension. Good. Let's go back to midline. Now let's do abduction. Abduction. Good. And let's do adduction. Good. Then let's do internal rotation of the shoulders. Good. The other side. Good. Then let's do external rotation. Good. Don't flex your wrist. Don't extend your wrist. Yeah.
Okay.
Do it again. Good. All right. The other side. External rotation. Keep your wrist straight. Good. All right. That's perfect. Bring it back to midline. Good. Now I'm going to just do one strength test for the shoulder. I'm going to like to do the flexion extension one. So for the flexion, so we know that. So keep your hands at 90. We know that flexion. No, keep 90. 90. Yeah, just straight. We know that flexion is going up, right? So try to flex your arm. No, not your elbows. Try to flex your elbow. Try to flex your shoulders. Good. All right. Then try to extend it. Good. So that's a strength test for the shoulders. It's 5 out of 5. Great. Now let's go to the elbows. So for the elbows, we're going to do a biceps curl, and that will be elbow flexion.
Okay.
An elbow extension. Bring it to your sides. Good. Then let's do supination, and then pronation. Good. So for the elbows, let's do the strength test. That's all we're going to do for the elbows.
Oh, okay.
So let's do strength test. So try to pull my hand. No, elbows. Try to pull my hand.
Oh.
Good. And try to, extend the elbows. Good. All right. So we're done with the elbows. Now we're going to do the wrist. So for the wrist, have it straight on the plane like that. Let's do ulnar deviation. And then go back to midline. And then radial deviation. Good. Then let's do flexion. Then back to midline. Extension. Back to midline. Then let's do abduction. Then back. Adduction. Good. And then let's do fingers flexion. That would be squeezing your arms. Finger extension. Then let's do for the thumb. Thumb flexion. Let's lift our hands like this. Thumb flexion. Okay, thumb extension. I want to make sure we can see you there. Good. Then let's do, let's keep our hands like this now. Then let's do thumb adduction. Adduction be to the side. Adduction. Then abduction away. Okay. Then let's do opposition of fingers. Good. All right. Good. So for that, let me do a strength test for that area.
Okay.
So the strength test I'm going to do is I'm going to use the fingers. Okay. So hold on. I'll tell you what to do.
Okay.
Yeah. So I want you to squeeze my hand. So that will be for the flexion of the fingers. So squeeze. Okay. I'm checking for strength. Okay. Oh, she's really good strength. 5 out of 5. That's good. You can let go now.
Okay.
Thanks. And then for the extension, try to open your arms. Try to open your fingers. Okay, good. Pretty strong. So that's strength test for that. So after that, we're now going to go to the legs. So for the hips, I want you to be able to, okay, I'm going to stand behind you and I want you to practice it. So let's do hip flexion. Okay, the other side as well. Okay, hip extension. No, it's that way. The other way.
Okay.
Hip extension. All right. Okay, then do the other side. Okay, good. Go back to midline. Then let's do abduction of the hip. Good. Then do the other side. Good. Then let's do adduction. Cross the midline. Good. And then the other side. Good. Then let's do internal rotation of the hip. So you have to sit down for that.
Okay.
Internal rotation of the hip. Internal rotation of the hip. Come a little out, a little bit. Okay, internal rotation of the hip. This will come out. Good. Then external rotation of the hip, the same side. Good. Then let's do this other side. Internal rotation of the hip. Good. And external rotation of the hip. Good. So let's stand up. I'm going to do a strength test for that. So let me try to abduct here. Good. And then try to have it out a little bit and try to adduct. All right, strength is 5 out of 5. So let's do for your knees now.
Okay.
So I'm gonna have you lay on the bed. Okay. Can you flex your knees for me? So that'll be flexion. Good. So you want your heel to go as far to your buttocks as possible. And do the other side. Okay, good. Then for extension, try to stretch your legs. For knee extension, yeah, your heels will be off, and hers are off as well. So that's good. You're fine. Knee flexion. So let's do the strength test for that. Can I have you sit up?
Okay.
Okay. So push against my leg, and then pull. Oh my gosh, you're really strong. Okay. All right. For the foot, what we're gonna do is let's do dorsiflexion.
Dorsey.
Good. You're facing up, dorsi, and then plantar flexion. Good. All right. And then let's do an inversion. So inversion. Do an inversion. Inversion. So inversion, your leg comes in. Yeah, inversion. So when you do an inversion, what you notice is that it's a combination of a lot of things. So there's supination, and there's also abduction. So I need to take off a socks to be able to really see that. So it's supination, and there's abduction, and also dorsiflexion. Then let's do inversion. So when you do eversion, so that's eversion. So it's like plantar flexion, and it's also like plantar flexion, pronation, and adduction, right? Good. You do it on the other side too.
Take it off.
That inversion, and then let's go to eversion. Good. Now let's curl up your toes. That would be toe flexion, and then toe extension, and then let's do abduction. All right, adduction. Perfect. Now for the strength test for that, dorsiflex, so you can and then plantar flex. Good. All right, perfect. So we're done with the strength tests. You want to put on your socks?
Yes, please. I got it. Thank you.
Okay.
Thank you.
So next one we're going to do is there's some tests, about 9 of them that I'm going to do real quick on each side. These are tests that will tell us if there's any laxity, any instability, or if there's a loss of integrity, okay, in these joints. All right. So the first one we're going to do is called the McMurray test,
Okay.
and that is to test if there is any meniscal damage. So any damage to the meniscus. All right. So let's have you lay that way.
Okay.
Okay. So the first one is the lateral, right? Lateral meniscus. So I'm going to lift your legs up. Okay. I'm going to lift your legs up. And pretty much what I'm doing, I'm flexing the leg at the hip. Okay. So I'm going to stop here and explain to you. So this is the McMurray's exam. So for the McMurray's exam, you need to test the lateral meniscus. So to test the lateral meniscus, I'm going to do an internal rotation. All right. So when I do an internal rotation, right, the internal rotation of the hip allows me to apply pressure to that lateral meniscus so I can test for the lateral meniscal damage. So I'm going to do that, and I'm going to then flex and extend. And I'm going to be checking every time I'm doing any of these exercises. What I'm checking for any pain. Is there pain as I'm doing this?
No pain.
Okay. I'm checking for any popping, any locking, and any clicking, any crepitus. Any pain?
No.
Okay. Then I'm going to do this. So I did internal rotation of the hip. Now to test the medial meniscus, I'm going to do the external rotation of the hip. So external rotation of the hip, and I'm going to then flex and extend again. Any pain?
No pain.
As I'm doing that? Okay. So that's the McMurray exam, and for that it's negative. So I'm going to do it on the other side as well. Okay. So again, I'm going to flex the leg. So for the lateral meniscus, I'm doing an internal rotation. Internal rotation for the lateral meniscus. And for the medial meniscus, I'm doing an external rotation of the hip. And I'm flexing and extending a couple of times. Good. So I didn't feel any, was there any pain with that?
No.
No, there was no clicking, there was no popping, and there was no pain, no laxity. So the next one I'm going to do is called the varus. Can I have you sit? Actually stand. I'm going to do the varus and the valgus exam to the elbow ligaments. All right. So the varus exam is for the. So these ligaments are, we'd call them the we'll call them the contralateral ligaments. So we have the lateral and the medial contralateral ligaments. So these ligaments, I'm going to test the lateral contralateral ligaments. And so what I'm going to do is I'm going to apply pressure from here. So she has her forearm supinated, all the way supinated, and her elbow is in extension, but not all the way, okay? So I'm using my hand to keep it stable, and I'm going to apply pressure this way. So that's the varus. And I'm pretty much what I'm doing is I'm applying pressure, right? Mm-hmm. I'm applying varus pressure to the lateral contralateral ligament. Any pain with that?
No pain.
Okay, good. Then the other side, what I'm going to do is I'm going to apply pressure from the outside to the medial contralateral ligament. So the medial contralateral ligament, and I'm going to then apply pressure again. Any pain?
No pain.
Okay, I'm going to do the same thing on the other side. So again, I'm going from the outside in. So this is varus. From the outside in. So this is valgus. And sorry, this is not varus. Because what I'm looking for is I'm trying to see if this ligament in the medial part, the medial contralateral ligament, is damaged. So the medial part is valgus. All right.
Okay.
Any pain?
No.
All right. And then varus to the lateral. Any pain?
No pain.
All right, good. So that's the varus and valgus exam. No pain with that, so ligaments are intact. Then after that, we're going to do the anterior drawer test.
Okay.
Can I have you lay down, please? So for the anterior drawer test, what I'm doing is I'm going to have my arms open and our shoulders open as well. This is for the anterior shoulder. And what we're testing here, we're testing if the anterior shoulder, if there's any injury, if there's any subluxation, or if any luxation at all, any instability to the joint, the anterior shoulder joint. So we're looking here. I have this my hand here, and I have my other hand here. So this is my proximal hand. You can see my thumb and my index finger. I'm going to have the humeral head, the head of the humerus here. And I'm keeping that stable. Then I'm going to pull this hand here. Okay, I don't know if you can see. I'm going to pull this hand here to 90 degrees. And I'm going to then move. Okay, you can see that? I'm going to be, it's a gliding motion. It's like I'm gliding the drawer, right? Anteriorly, right? From neutral to anterior, back to neutral, anterior, back to neutral. And that plane is the anterior medial plane. So the glenohumeral joint, the anterior medial plane, and I'm just looking for any laxity, any instability, or any loss of integrity. Any pain with that?
No pain.
So negative anterior drawer test. I'm going to do the same on the other side. Maybe it'll be easy to see on this side. So again, I'm going to have this arm up. All right, I'm going to get here 90 degrees. Okay, and then I'm going to get the anterior drawer. So drawer up and down to neutral. Up to drawer, down to neutral. Up to drawer, down to neutral. So that's the anterior drawer test is negative. Now the other test we're going to do is called the Apley scratch test. And for that one, we're going to be back in the camera. The Apley scratch test, we're using that to check the shoulder range of motion to make sure they're intact, so that we know that these muscles in the back here that help us with our shoulder range of motion are not affected or damaged. So can I have you do the first Apley? So the dorsal part of the hand comes up here, and then she uses that to try to see if she can hold that. So her dominant hand is the right hand, and I think that's why it seemed like it was a little difficult for her to get this arm up here because of these muscles here. So sometimes there's a little bit of restriction with your dominant hand. Now that's the Apley scratch test. Any pain as you did that?
No pain.
Okay. Now let's do the other way. When we do it the other way, you can see there's internal rotation and there's external rotation here. And here, now, how was that? So it seems pretty equal. Do you have any pain there?
No pain.
No. So that seems pretty equal. So that's the Apley scratch test. And the Apley scratch test is negative. Now the next test we're going to do is called the empty can test. The empty can test is to test if the supraspinatus muscle is damaged, and to also see if there's any shoulder impingement. Okay, so let's have your arm up into the scapula or scapulus. Let's have you facing here.
Okay.
So 45 degrees. Yeah, good. So give me a little bit up here. Okay, good. So for the empty can test, I want you to medially rotate your hand in until your thumb is facing down. Good. So as that, I'm gonna apply some pressure, and don't let me. Okay. Is there any pain as I was doing that?
No pain.
Now slowly drop your arms slowly with control. Was there any pain with that?
No.
And there was no jerking with that. So the empty can test is negative. Now let's do the drop arm test. Okay. So the drop arm test, I'm going to raise your arm for you.
Okay.
Okay. So I'm going to raise your arm. I'm going to abduct it to 90 degrees. Okay, like across, and I'm going to do an external rotation, so facing, like that. Good. So what I'm going to do is I'm going to let go of my hands, so keep your arms up. Okay. All right. So here, this is the rotator cuff test. This is to test if the muscles of the rotator cuff, the supraspinatus and the infraspinatus, are affected. Any laxity with them, any pain with them, if there's any tear, partial or full tear. Now, Does that hurt as you were doing that? Okay, good. Now, can I have you lower that? Lower your arms. Okay, any pain with that?
No pain.
Okay, no pain. So that's the drop arm test. If there was pain with that, then there will be problems, probably to rule out any supraspinatus or infraspinatus tear, pressure, or full thickness tear. Now, that's the drop arm test. The next test we're going to do is called the apprehension test.
Okay.
All right, the apprehension test, I'm going to have you lay back down again. I'm sorry, I keep having you up and down.
It's okay.
So for the apprehension test, what I'm doing is here, I'm going to have our arm up in external rotation, and I'm going to apply a maximum external rotation force to the glenohumeral joint. Now with this test, if she was starting to get apprehensive, or if there was fear of luxation, then it will be a positive apprehension test. So I'm going to apply as much maximal force as I can, as maximal external rotation force as I can. Any pain with that?
No.
No. Let's try it on the other side. So she has a very flexible shoulder. So again, what I'm applying is the maximum external rotation force here. Any pain with that? At the glenohumeral joints. Good. So there's no shoulder impingement here. So that's negative apprehension test. Now the next test we're going to do for carpal tunnel. So can I just sit up? Okay, good. So the carpal tunnel, I'm going to do the Tinel's sign. The Tinel's sign. The Tinel's sign, we're checking for medial nerve compression. So I'm going to start here at the carpal tunnel at the wrist, and I'm going to tap. I'm going to tap, almost like I'm percussing. I'm going to tap. Any tingling?
No.
Any paresthesias?
No.
So I'm going to go to the index finger. I'm also going to tap. Index finger down to the carpal tunnel, down to the elbow. Any tingling or paresthesia?
No.
I'm going to do the same thing on the other side. I'm going to tap here. Any tingling?
No.
Okay, and I'm going to go to the index finger as well. So as I'm tapping here, if there's any kind of tingling or paresthesia to the thumb or to the index finger, to the middle finger, or the lateral end of the ring finger, then it'll be positive Tinel's sign for carpal tunnel syndrome. And that will tell me that the medial nerve is compressed. All right? The last sign we're going to, or last test we're going to do is called the Phalen's test. For that, I want you to flex your wrist and I put the dorsum part together, okay? And then bring it closer to your chest. And then for a minute, I'm going to monitor her, and I'm going to monitor to see if there's any pain or any tingling or any paresthesia.
No.
To the thumb, to the index finger, to the middle finger, or the lateral end of the ring finger. Any of that?
No.
So that means her medial nerve is not compressed, and that's negative Phalen's sign. And that will be it. Thank you very much. So I've successfully checked your physical. I didn't find any abnormal finding. Everything checks out well. So there's nothing to do today. We're just going to check your labs, very regular lab, your CBC, your chemistries. We're going to check, if you want us to check for STDs, it won't mean you're not sexually active, so we don't need to check for that. But we'll check your thyroid function. We're going to check your lipids. Are you fasting?
No.
Oh, you're not fasting? Okay, so you would have to come back for your fasting labs. And then we'll just, in 2 weeks, we'll follow up with you with your results.
Okay.
Maybe with telemedicine.
Okay.
Do you have any questions for me?
No questions.
All right, this marks the end of this physical. Thank you very much.
Thank you.